and again just towards me a tiny bit.
It is clear now that care homes and their vulnerable residents have paid a heavy price in this crisis.
Okay.
Deaths quadrupled in 1 week leading up to April the 10th. Tests now for frontline staff are key to this fight, and the Health Secretary, Matt Hancock, said more tests were being carried out.
It's terrific that we have managed to increase capacity to over 39,000 tests a day, which is higher than our planned trajectory. Of course, having excess capacity means that we can then expand who that capacity can be used by.
But that's not the full story. Tests for social care workers are limited to a few sites around the country, and no one seems to know how many tests have been carried out. To try to discover how widespread tests for social care workers have been in the last week, we asked the Department of Health, Public Health England and the Care Quality Commission for exact numbers of tests carried out in the last 7 days. We haven't been given an answer to that. And so we asked the National Care Forum to ask their members on behalf of Sky News. Of those who had tests booked in, only a quarter were able to get to them, and the average round trip to get to a test was 60 miles. Chloe Butler is a carer suffering COVID-19 symptoms. To get to her local test centre would mean a 140-mile round trip.
The minute I heard it, I was in shock. I was like, there's no way I can even get anywhere near Leeds. Obviously, no train, no bus, anything. I can't go out like that. So it was just really hard to hear.
David Ramage is Chloe's boss and says the tests are too far away.
If they don't have anybody to drive them to there, then they can't access a test. So potentially 33 of my staff couldn't access a test anyway, even if I requested a one for them.
Because as soon as you finish those trainings, we can get you booked in and then we can get you a start date. Is that okay?
Care homes are now a month into this crisis, and here in Sheffield they're trying to find care and nursing staff to replace those off work.
I think we're just reacting daily, weekly to the issues that we're being faced with, and I think it's really important that, you know, it's recognised what we're doing and the support that's needed, and that it gets to the frontline service. I think lessons need to be learned from this.
And obviously you've got a specialised role, you've been best trained.
The National Care Forum says providers are anxious. Many say that test results are coming back too slowly and that guidance is muddled and often confusing.
Drive-in centres are not necessarily ideal for people working in a distributed system like the care sector. We're piloting a number of different ways of getting tests out to people, both directly sending swabs to care homes, also, as Secretary of State mentioned, testing at home, and also mobile delivery.
Coronavirus and care homes has proved a lethal combination. Tests remain key if care homes are to cope. Nick Martin, Sky News, Sheffield.